There are times that patients need to be on pharmacological treatments, especially for lipids. So we can get started with the lipid treatment for hypercholesterolemia or dyslipidemia. So first is HMG CoA Reductase Inhibitor, or the statins. They are hydroxymethylglutaril coenzyme A reductase inhibitor. Again, you don't have to remember that or memorize that. It's enough for me if you know HMG CoA Reductase Inhibitor or statins. So what's the mechanism of action? So how does that work? Statins works by inhibiting the HMG CoA reductase enzyme activity in the liver, which is required in order to produce cholesterol. And so that results in a decreased cholesterol synthesis, which decreases the rate of cholesterol production. What are the therapeutic effects? So it does decrease the total cholesterol, and it does affect all the individual types. So it can affect the HDL and the LDLs. What are the indications for statins? Statins are indicated for hypercholesterolemia. Later on during this unit, you'll also find out that statins are also used for other indications. But for this specific part, the indication is hypercholesterolemia or dyslipidemia. So there are precautions when it comes to taking statins. I don't know if you guys can remember, but precaution and contraindications are not necessarily the same. Precaution is something that we're keeping an eye on. Usually it's still okay to give it depending on the situation. We just need to keep an eye on certain things. So for statins, these are the following are the precautions. Take precautions when it comes to a patient with hyperglycemia, if they have pre-existing muscle weakness. And there's also, we need to take precaution with altered neurostatus, pre-existing confusion or dementia. And then lastly, if somebody's liver function is slightly elevated for an unknown cause. So those are the things that we need to keep an eye on. Now, when it comes to contraindication, so this medication is considered a pregnancy category X. And again, if you can remember from our previous lecture, the FDA has already changed the categories, but for a lot of the older medications, which statins is one of them, they still use the categories, the letter categories when it comes to pregnancy and lactation. So for this specific pharm class for the statins, it's a pregnancy category X, meaning the studies demonstrate that fetal abnormalities and there's evidence of fetal human risk outweighs potential benefits in pregnant women. That being said, I have been reading an article that certain groups and organizations are actually trying to remove this pregnancy category X on statins. But as far as when it comes to official removal of that, I haven't really seen that yet. But, you know, with medicine, the way it's evolving, that can be changing. But for now, this is known as a pregnancy category X medication. Another contraindication for statins are liver dysfunction or liver disease with elevated liver enzymes. And the reason for that is statin can make that worse if you have a patient whose liver function is already not great, or basically their liver is failing. This is definitely contraindicated for that kind of patients. So like most medications, statins have side effects. One side effect that sometimes can be observed is hyperglycemia. So it is unclear as to why this can happen, but it does show that it can affect insulin, therefore causing some hyperglycemia in some patients. Another very common side effect that a lot of patients complain about, and also this is probably one of the reasons why some patients are actually non-compliant when it comes to their medication, is myopathy or muscle pain. You'll hear that from older people who are on statin, or even younger people. And so this is something that you may want to ask your patients, are they experiencing this? And it's also something that we may need to educate our patients that this can happen with them when they take this medication. In relation to the myopathy, so how does it really happen? So somehow statin can affect the muscles. So it causes the release of CPK. So that CPK and myoglobin and protein, that there's an increased amount in the bloodstream, which then can eventually harm the kidney and causing kidney failure. And usually the signs and symptoms will include dark brown reddish urine. And that's called rhabdomyolysis. So sometimes the muscle injury can be quite severe that leads to rhabdomyolysis. So that's one of the adverse effects from statins, and that's something that we really need to keep an eye on. It doesn't happen often, but it does have, there is a risk for that to happen. So it is something that we need to monitor our patients with, especially if they're newly started on statins. Another side effect that a lot of the patients who take statins complain about is headache, memory loss, and confusion. That's also one reason for patients refusing to take statins. And again, sometimes, it is very understandable why they refuse to take it. So it's a matter of weighing the risks versus benefits. And that can really be done better by educating our patients, and that way they themselves have an input and they can weigh what are the risks of developing memory loss or confusion versus having a worsening CAD. And then lastly, most common side effect would be GI disturbances and liver dysfunction. Again, that's why it's very important to monitor for possible side effects and monitor your liver function tests. So nursing actions, what are the things that we need to do as nurses when our patients are taking statins? Optimal dosing time. It is very important to educate our patient that statins are mostly very effective. They're most effective at night, so they need to take the medication at night because most cholesterol is synthesized when the dietary intake is at its lowest, and it's usually at nighttime when we're not eating, so at bedtime. Another thing that we need to do is assess and then definitely do patient education regarding the neurofunction, muscle weakness, glucose control, GI symptoms, and urinary changes. So these are the things that we need to tell our patients to report, so then we know right away if they're experiencing any possible side effects or adverse effects from the medication. So this medication affects the liver. There are various drugs, and there's also grapefruit interaction. So I don't know if you can remember from our previous discussion, that can cause an interaction with statins. So grapefruit contains a chemical that interferes with the body's ability to metabolize statin medication, so that it increases the amount of statin in blood levels, and then it can increase the chances of side effects. So again, it can increase the toxicity of this medication for certain individuals who are consuming grapefruit juice. And lastly, it is very important to follow our lipid panel. If you're treating something for cholesterol, then you want to know first what's the cholesterol level before starting them on the medication, and also follow up with where is it now? Are we accomplishing our goals? So the way to find out is really monitoring our lipid panel. And because we know that one of the side effects is increase in blood sugar, we also want to monitor the blood sugar levels of our patient. And last but not the least, LFTs, right? So if we know that it affects the liver, then we want to monitor the liver function test of our patient to make sure that it's not affecting it or it's not making it worse. So these are the examples of drugs in the class. We have Crestor or rosuvastatin, Lescal or florvastatin, Lipitor or atorvastatin, Livalo or pitavastatin, Mivacor, lovastatin, Pravachol, pravastatin, and Zocor, simvastatin. The ones with the asterisks are the ones that you have to remember. So those are the prototypes that you want to remember. But also, although it doesn't have a parenthesis, I want you guys to also know that Crestor or rosuvastatin. So there are studies out there that's saying that rosuvastatin is more effective in women compared to, let's say, simvastatin or atorvastatin, which are mostly used in the general population. But they've been doing some studies showing that when it comes to Crestor or rosuvastatin, that's more effective for hyperlipidemia in women.